Well, good morning, everyone. And once again, welcome to another live this morning. Love having you guys on. So as you get your notifications and you want to say hello, give us some love. And always nice to have you on. If you can come on live, it's fun for me. And we appreciate it big time. Okay, Andrea, guess what? You're number one. Rosalinda, you came out of the clouds today. Both of you from Niagara Falls. Nellie, Bonnie, how are you? Nativity, good morning to you. Maria from Ottawa. And Sandy, Fergus Falls, Minnesota. Wendy's on with us this morning from Markham. Nellie's on. All my dear friends, thank you. Diane, Peterborough, Georgie, Halifax, Nova Scotia, Rosa's in Montreal. Lisa, how are you? Barishant, Frida, and Patricia from Florida. Janice, how are you from Brampton this morning? Lucille, good morning to you. Maureen, Boca Raton, Florida. Hi, Ann. And it's really Annie, isn't it? From Lively. And Karen, Patricia, Cheryl, West Virginia. Fran is on with us this morning from Orangeville. Diane LaSalle. Terry from Prince Rupert. How are you? Elaine, St. John's, Newfoundland. Dennis from Norwich. Karen, Coldwater. Ooh, cold. Vince, how are you? Lorraine, British Columbia, bright and early this morning. We appreciate that. Hi, Laurie. Betty, Aylmer, Ontario. Etta's on with us this morning. Carol, West Virginia. Gloria from New York. Amber from New Jersey. Excuse me, Donna from Newfoundland. Sue's on with us this morning. Hi, Sue. Sherry. Oh, I could sing, Sherry. I could sing. There's my good buddy, Dr. Troy Bennett in Newfoundland. Love you. How are you? Meta. Rain Cloud from Michigan. Sandy from Vancouver, Washington. Sharon, Kansas. Donna, couple of more, guys. Hi, Bruno in North Bay. Mara in Windsor. Susan from Bolton this morning. And Frances Marie. Doc McEwen, I finally see your name. How are you? Dear friend Doc from West Tennessee. Who is Heather from Miramichi? Dave, Claudette, Jean, Sandy, Chilliwack, British Columbia. I don't see the mayor either, Rosalinda. I don't know what is happening. Hi, Judy. Elaine. Okay, guys, got to finish out here. Hi, Darcy from Wisconsin. Lee's, good morning to you. And Lorraine from Halliburton, and Arlene. We love you. Guys, thanks for coming on. You have no idea how much I appreciate it. Okay, Marilyn's asking a question. We're going back to Q&A. VJ from Toronto. Doug from Paris, Tennessee. Cindy from Saskatchewan. Marilyn is asking a question. Marilyn was in bad shape. 64. Thyroid issues, big time. Autoimmune thyroid issues. Sjogren's, hypothyroidism, thrombocytopenia. She's been carnivore for 14 months. No dairy, meat, eggs. I take almost every supplement you have. Thyroid came back worse. Well, maybe in numbers. Like, really important, Marilyn, for me. Okay, really important. Because you're asking me to give you advice, but I got to ask you the question. Okay, you went carnivore for 14 months. I would have had you on the reset. Maybe not for that long. But you went carnivore. I got no problem with that. Okay? How are you feeling? Because I have to say it almost every day numbers, not that I don't look at them. Okay? I do. Okay? I looked at blood work. It feels like 1,000 times a day. Now, it wasn't that much, but it felt like it. Okay? I always looked at blood work. But, and guys, you know this. What are your symptoms? How are you feeling? You've been on the reset. No, you have actually been on carnivore for 14 months. Marilyn, how are you feeling? What are you seeing? What changes? Symptoms I'm talking about. Because that's really important, because I always look at that even more, especially when it comes into the thyroid and that. Okay? How you feeling? Okay, you gave me your blood work. Okay. Well, the blood work, it hasn't seemed to change much. As a matter of fact, your thyroid numbers have gotten worse. But I don't put a lot of stock in that until I know what you're feeling. In my opinion, okay, and without knowing you, Marilyn, okay, in my opinion, you wouldn't have stuck to 14 months of the carnivore diet unless you were seeing some changes. Now, that's just my experience with people. So I need to know that. There's our mayor. Kevin, I see his name. Okay, so what you do, let me know how you're feeling. Give me all your symptoms, before and after, because that goes with your blood work. Believe me, that's really important. The old-fashioned doctor was very interested in your symptoms. Okay? Because medicine generally has been hijacked by the labs. They're hijacked. That's all they look at. A patient is almost invisible to most modern day doctors. All they want to do is look at blood work. And they make a big mistake doing that. Okay, Marilyn? So send me your symptoms, info@martinclinic.com. It will come to me. Okay. Linda. Oh, we love Linda's. She's dealing with a flare-up of diverticulitis. Well, that ain't no fun. Let me give you, Linda, what I've seen, first of all, over all my experience with diverticulitis, okay? Generally, and I think 90% of the time, when it happened in women, you know what? They were salad eaters. They lived on salads, and they lived on seeds and nuts because they were told it was good for them. They ate a lot of fiber because they were told they actually needed that big time. And they didn't eat a lot of meat, and they didn't eat a lot of eggs, and they didn't eat a lot of good dairy. Okay, that's just general. Now, you might be an exception to that, Linda. But generally, that's what I saw over the years. So when everyone had a flare-up of diverticulitis and they came to see me, I said, well, you got a sunburn down there. You got a sunburn in your descending colon there on the left side, and you got pouches in there. So now, until we get rid of the sunburn down there, the real irritation, the infection actually, because you get feces that get stuck in there. And doctors say, well, if feces are stuck there, you want to have more fiber. No, that'll irritate the sunburn. That will irritate the infection. Go very bland. Drink water, drink coffee, and lay off the fiber. No salads. Okay? Now, what supplements? Always probiotic. Start at the top of the gut. What's at the top of your gut? your stomach. Start there. Enzymes, every meal. Digestive enzymes. Because you want all your food that you're eating to be broken down big time. And most people with diverticulitis or diverticulosis or even IBS or IBD, their problem starts in the stomach. And they don't have enough acidity there. It doesn't break the protein down properly. And that comes in and irritates the gut. And then they eat way too much fiber. No fiber, lots of water, coffee heals. Okay? No seeds, no nuts. Be pretty bland until that thing heals up. Digestive enzymes, probiotics, bone broth, because of the L-glutamine, which regenerates the gut. Our IBS formula, all mucilages that help to restore, regenerate, replenish the lining of the bowel. All those things. And the best fiber is coffee and water. Okay? Thanks for the questions. Question. That was Linda. We love Lindas. Listen, Linda, listen. Caroline. How does a man increase his testosterone? Well, let me just pull out a book. Okay? I'm going to pull it out right in front of you. Here I am. Sun increases your testosterone. Steak increases your testosterone. Steel, okay? Muscle increases your testosterone. Sleep increases your testosterone. Sun, steak, steel, and sleep. That's the problem with men. Men, okay, and this is a fact, guys, oftentimes have more estrogen than they have testosterone. They often have more estrogen than their wives. I used to tell men that because I used to test them. And I said, you got more estrogen than your wife has. Okay? Vitamin D. You're low. You need good luck with the sun. It's not out today. Take vitamin D. I did this morning. I take it every day. See? Vitamin D. Okay. You need that. And you might want to, Carolyn, tell your husband, if that's who you're talking about, to get some flax seeds and dim out the estrogen. Because, see, with a woman, it's estrogen, progesterone. And a man, it's testosterone and estrogen. If estrogen goes up, testosterone is going down. If testosterone is going up in a man, estrogen is going down in a man. It's just the way it is. It's a teeter-totter. Okay? Sun, steak, and steel. You ever heard of that before? And sleep. Okay. Thank you, Carolyn. Susan. Suzanne. Okay. Suzanne's asking a question. It's a good one. How exactly is stress affecting my, having the same effect as carbs and sugars on the body? How does that happen? Well, here's how it happens, okay? Suzanne, here's how it happens. When you're stressed, what is the hormone called? You know this, okay? Close your books. It's a little test. What's the hormone called? What's that called? Cortisol. What does cortisol do? Well, cortisol gets you ready for the fight or flight. it's getting you ready, okay? Very normal. It's getting you ready to start your day, right? So cortisol goes with your circadian rhythm. It's very normal, except when it doesn't get turned off. Because think of it. What does cortisol do? Well, it elevates your blood sugar because it's getting you ready to fight or run. Up, 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 up. Well, what goes up must come down. So think of it. How does the stress hormone cortisol, how does it affect your blood sugars? Yep, up. Up. Blood sugar goes up. Now imagine that cortisol never goes down during the day. And that's for a lot of people. Stress has a major effect. It pours gasoline on the fire of your metabolic syndrome. If you have it even to start off with, it even gets worse. And that's why independent of food, cortisol can elevate your A1C. Because cortisol should have a part-time job. But we live in a world where stress, look, ever since man has been on the planet, you've had adrenal glands. You need them. They're there for especially your fight or flight. You're getting chased. Okay? Let's say a lion is chasing you. Okay? But what happens if that stress doesn't stop? It keeps coming and coming and coming. Man, that can mess you up. Elevate your blood sugar. Because of that, your insulin has to go up. Because insulin has a job to do. It cannot allow your sugar to stay in your bloodstream. It's extremely toxic. So that's how it works. Okay? That's how it works. Hold on a minute. Let me just see if you had a second part. Yeah, you're asking about, you're eating good and your A1C isn't coming down. That can be a major factor. A major factor. Get on the cortisol formula. Okay, that was Suzanne. Teresa, what are your thoughts on going 2 or 3 days without a bowel movement? Nursing homes are big on tracking bowel movements. Ooh. Well, look. Teresa, unless you have never been listening to me, let me repeat what I think. Okay? I'm not saying you shouldn't have bowel movements. Okay? So don't misquote me here. It's just that listen, I've listened to this as long as I've been in practice because Dr. Kellogg started the whole thing. You know what he did? You need fiber because you ain't going to have a big enough stool. You're not going to go to the bathroom enough times. We're going to give you a prize for having the biggest stool, said Dr. Kellogg. Well, he didn't really say it like that, but he meant it. And we started the whole fiber craze. And like I said, it's one of the reasons we see so much diverticulitis and diverticulosis and IBD in this world. I'm telling you. You're not supposed to live on fiber. You're just not. Well, Dr. Martin, if I don't have my oatmeal, I ain't going to be able to go number 2. I heard that a million times in my office. Okay? And guys, I'm not saying you shouldn't go to the bathroom. You don't have to go every day. It depends. You know what I mean? Like, think about this for a minute. What is your stool? Waste. True or false? It's true. Your stool is waste. It's going into the toilet. Right? That's waste. When you're eating the right foods, nutrient-dense foods, you make less waste. That's how it works. When you're a carboholic, you're going to have big stools. And some people think, well, that's wonderful. They think detoxing, okay? A lot of people do this, okay? I heard this again. When I say 1,000,000 times, okay. It wasn't 1,000,000, but close to it. I'm doing it. When I go to the bathroom, I'm detoxing. Yeah, to some extent. But your big detox organs is not your bowel. It's your liver. It's your kidneys. Yeah, your bowel. But you don't have to clean it every day. Well, let's scrub it. That's what fiber does. It scrubs it. It sounds good. Okay? It sounds good. But it's way overrated, guys. So you're in a senior home, they're going to give you and listen, one of the biggest reasons they're constipated, okay, other than they eat way too much fiber, is the medications they're on. Like, you go to a senior home, and my word, they're on about 20 meds. Well, their peristalsis in their gut is crawling. They're put into zombie land with all the medications they take. And they take one for the blood pressure, and they take one for the side effects of the blood pressure medication, and yada, yada, yada. They're all on statins. They're all on that. And isn't it true? And then they give them a sleeping pill. And then, and no wonder. Messes them up. I remember one time I visited a dear friend in the nursing home, and I said, how many pills are they giving you? 30. 30. I felt like saying, well, they're killing you. They're killing you. It's just slow. Anyway. Okay. That was Teresa. PD. Okay, anyway. PDI. Is there any truth to wearing hearing aids to decrease dementia? Apparently. Okay? Apparently. Hearing has an effect on the hippocampus. You can't hear, your brain shrinks. And I've read studies on that wearing hearing aids will help that. What happens when you become a senior? A lot of people lose their hearing. It has an effect on the brain. For sure. So wear your hearing aids if you need them. Like, whenever I speak, you know what people who have hearing aids tell me? Doc, I don't need it. I don't need my hearing aids when you speak. I said, is that a good thing? I got a built-in microphone right here. Okay? That's what my son says. Okay, Teresa, hold on. Same Teresa? Nope, different one. Another question. Started taking iodine drops because I think I may have a sluggish thyroid. Well, if you got the symptoms, you got a sluggish thyroid. Okay? Hair. Eyebrows. Dry skin. Look sideways at food and you gain weight. Lethargic. Yada, yada, yada. For thyroid. So Teresa says, I took iodine and can it be harmful if you don't need it? No, you need it. Who doesn't need iodine? It's not even in our soil. It's devoid. Your thyroid needs iodine and steak in selenium. Okay? Selenium's in steak. And your thyroid needs vitamin D, and your thyroid needs B12, and your thyroid needs a lot of things to work properly. And you don't want to be out of balance with your estrogen and progesterone. Because when you rob progesterone, estrogen dominates, and now your liver, you're not clearing the extra estrogen out of your liver. Anywho, okay. John, you've been listening, John, because you're saying smart things. John says, Dr. Martin speaks about estrogen and high insulin that causes the prostate to grow. Okay? But what does a man do to reduce the swelling that has already happened? To be able to urinate better? Well, I'm a big guy on, okay? So obviously, lower the estrogen. Lower your insulin. That's food. I love, for the prostate, Navitol. And the reason is, guys, whenever you think of Navitol, okay, think of blood flow. And prostate, what happens? You got diminished blood flow. Big time. Okay? Too much estrogen, too much insulin. The prostate grows. Okay? And, okay, like that also has a diminished blood supply. The little capillaries and arteries that go to the prostate. You want to increase that. Diet, block the extra estrogen, and Navitol. One of the best things you can do for the prostate. Okay? We got a new prostate formula coming too, by the way. To a theater near you. Okay. That was John. Thank you, John, for the question. Betty, my daughter's in college, noticed worms in her stool. Yikes. Okay? It's better, by the way. Okay? Because I used to do stool analysis too. Okay? Bring me your stool. Put it under a microscope. Okay? Not the whole thing. But just a little Q-tip worth on a slide. And you could see it under a very powerful microscope. You'd look for parasites. Okay? And, okay? I have been telling her to take probiotics and oil of oregano and avoid all sugar. You're a smart girl, Betty. Okay? Any idea? Okay, it looks like blue veins, stretch marks are on the top of her stomach. Could it be parasites? Maybe. Maybe. Ask your daughter, Betty, if she has a cat. Get rid of the cat. Cats and parasites. What? Yikes. and then they lick you. Okay? But no, the best way is probiotics and oil of oregano, anti-parasitical. And don't feed them. They love junk. Don't give them junk. Okay. Tara, 56-year-old women in menopause. Okay. Very dry skin, wet, macular degeneration. You take Dr. Martin's products. Okay, good for you. You're smart. What is your take on this? I know, good, better, best. Astaxanthin, a potent carotenoid based. I know what it is. You want to take it, Tara? I got no problem with that. Okay. I like Navital better, but okay. I got no problem. And yeah, I like astaxanthin. I have trouble with big words. They don't roll off my tongue. They trip me up. Hey, Tara, you want to add that to your regimen? Go for it. No problem at all. Kristen, I have a question about foot pain, she says. Okay. I'm not sure if I'm dealing with plantar fasciitis or not. My heel and arches hurt. Pain is severe. I'd say if I had you in my office in my practice days, I could have told you in 5 seconds whether you had plantar fasciitis or not. Okay? And usually this was me. Whenever I saw plantar fasciitis, it was always the metatarsal arches falling, flattening out. And so I did everything I could to lower inflammation. A lot of people found with plantar fasciitis, as soon as they got off the sugars, because remember, sugar doesn't cause the plantar fasciitis, but anytime you see an itis, you're talking about inflammation, and sugar is very inflammatory. So one thing you want to do is lay off the sugar, because a lot of people, that helps big time with plantar fasciitis. Now, I believe in, really good arch supports, and you don't have to spend $500 on them, like orthotics and that. Some people swear by them. I like more the good arch supports. Roll your foot on a tennis ball, or even something harder like a bottle or whatever. Roll. You got to elevate the metatarsal arches. Okay? I like curcumin mixed with Navital. Blood supply plus anti-inflammatory, both of them. Okay? In terms of treatment. You might want to get some manual therapy on that too. Okay, Kristen? Merci. Okay, I think hold on, is that done now? Joanne, okay. Again, A1C, might have answered this the other day, I don't remember. Why would my husband's numbers go from 6.3 to 6.6 A1C after 2 weeks? Finished the reset 2 weeks ago. Well, Joanne, look, Rome wasn't built in a day. I don't know your husband, but he's still on the right track. A1C is an average, okay? And sometimes it takes longer for A1C to go down, and sometimes it'll go up a little wee bit before it goes down. Don't get discouraged. The best thing to do is lower that insulin. 100%. And there's no exceptions to it. Okay. It can change. Don't get discouraged. Any thoughts on nattokinase? I talked about that. I think I did. I answered everything. Okay, nattokinase. Look, it's anti-clotting. I like it. Okay, I do. Yeah, if you're worried about clotting, you could take nattokinase for sure. Okay, I think I'm done. I think I answered every question. I hope I did. If I didn't, would you let me know? Okay, guys, we love you. Thanks for being the best audience in the world. You can share this, okay? Share it. And then you know what happens when you share it? That's showing us love. And you know what happens? Facebook shows us even more love because they share it too. It's how their algorithms work. Okay, guys, we love you. We'll talk to you soon.